Chapter 11. Medical Education 1. Medical education in the United Kingdom. Medical education in the UK cover undergraduate education, 4 or 5 year at medical school, the section of a university responsible for medical education. A 2 year foundation program, which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GPAs or consultants, senior specialists, often delivered through college for different specialties. For example, the Royal College of Physicians. Continue professional development in the form of courses and seminars which doctors undertake through their working lives to keep up to date. Extract from an undergraduate prospectus. The MBCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5 year undergraduate medical degree course. Most of you learning takes place in small group. The main components are core years 1 to 3, integral program of clinical and scientific topics, mainly presented through problem-based learning, where you work with others on a series of case problems. Student-selected modules allow you to choose from a menu of subjects such as sport medicine or even study a language as preparation for an overseas elective, a hospital attachment of your own choice between years 4 and 5, vocational studies and clinical skills. The components prepares you for the clinical skills required for contact with patients from year 1 or your course through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments, years 4 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics and gynecology and general practice. A student's view. Ellen, a medical student, described her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2 hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up book and online sources, make notes and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5, but now it's mainly group work, although we do have some lectures and seminars where we work in small group with a tutor. I like all of it, even dissections. We get to coop up cadavers from the second month of the course. Exercise. Match this activity to the stage of medical education in the UK given A opposite. Dissecting cadavers, keeping along of surgical procedures observed and performed, working for 4 months in accident and emergency to experience the specialty, taking a 4-week attachment in obstetric and gynecologist, taking an online course of recent developments in cardiovascular disease. Complete the sentences. Look at A and B and C opposite to help you. Just before their final year, students have the chance to take in a hospital of their choice anywhere in the world. Contracts with an approach where each subject is these days are often interactive with regular opportunity for the students to ask questions. In students learn how to treat and manage patients. Can be a topic from outside medicine, such as foreign language. This section of is an important part of the anatomy component. At the University of Edinburgh is one of the oldest in the UK. She's at the Royal, one of the leading pediatric heart specialists in the country. The Royal of Surgeons is Edinburgh, dates from 1505. We have each week where we discuss topic in a small group with lecturer. Match each of this activity to one of the components of the undergraduate course, described in B and C opposite. Julie spent 6 weeks working in a small hospital in Himalayas. A group of students discussed together the possible reason for abdominal pain after meals in an obese 44-year-old male. A small group of students traced the pulmonary artery in a cadaver. Otto spends a month working in the pediatric ward of the local hospital and learns how to take blood from an elderly patient. Yuma chose to study travel medicine in this 4th year.